Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Management of stress urinary incontinence. According to the earlier concept, if there is anatomical hypermobility of the urethra, then we do colposuspension. If there is intrinsic sphincter deficiency, then we do pubovaginal sling surgery. The examples of pubovaginal sling surgery are Albrecht and McGore slings. New concept is colposuspension. Colposuspension has no separate surgeries for different causes. Now, according to the new uh, concept, we do colposuspension for all the causes. There are no separate surgeries for different causes. So we have burst colposuspension and Marshall and Marchetti Krantz technique. According to burst colposuspension, the proximal urethra is suspended to the Cooper's ligament, and this suspension of proximal urethra to the Cooper's ligament is gold standard for stress urinary incontinence. Second, Marshall-Marchetti Krantz procedure. According to Marshall-Marchetti Krantz procedure, proximal urethra is suspended to the pubic symphysis. This Marshall-Marchetti Krantz procedure is not done. Complications of this procedure is osteitis pubis. Both these burst colposuspension and Marshall-Marchetti Krantz procedures are abdominal surgeries. In proximal urethra, if proximal urethra is suspended, in both these conditions, these both are abdominal surgeries. In both these conditions, proximal urethra is suspended. Earliest tests which are done for stress urinary incontinence, like Q test and Bonney suspension, are outdated now. Now we do urodynamic studies are needed for urge incontinence, not in stress incontinence.
Urodynamic studies are done for urge incontinence. Stress incontinence, we can directly uh, detect it based on the history itself.
thank you and thank you for watching.